Donna?
I recently read this book, Against Depression. Last name of the author was Kramer. And his premise was that with every depressive episode, it causes more and more brain damage. So I guess my question to you is, you're saying, try to address this right away as soon as possible, depression as soon as possible. How can you tell the difference between a depressed person and melancholic?
Melancholy?
Yeah, somebody that just is naturally melancholic.
I don't believe that melancholy is just a form of a personality disorder or a symptom of personality disorder in general. I think if you're seeing someone who looks melancholic to you, they're depressed. I think that people can have sadness and have a bad day and those kinds of things, but again, the telling thing is it persistent? And in the old days, again, back in the 30s and 40s, they still called depression melancholia, but it really was depression. So that's my stance on it, is that it is depression, and it needs to be evaluated and treated. Pardon?
I was asking, I don't mean to chime in every time, but Joan made fleeting reference to dysthymia and cyclothymia. Dysthymia is major depression's baby brother. It's kind of the rheumatoid arthritis of depression. It doesn't kill you, it just messes with you. It makes your life uncomfortable rather than unendurable. I think what we think of as melancholy frequently is dysthymia, a lower grade of depression, but still a treatable form of depression. And I'm going to be repetitive, forgive me, but if the person is actively engaged in substance abuse, you can't make that diagnosis accurately. Those of you that are readers, and it's a horribly depressing book, but most of the people who experience severe major depression are too damn depressed to write very well. There's one exception, a book called Noonday Demon by an author named Solomon. If you want to know more about major depression, read Noonday Demon, which again will depress the crap out of you.
Well, the other book that I would recommend for an excellent narrative description of major depressive disorder is William Styron's Darkness Visible, which is a very brief, very short book, but it's beautifully written. And as a clinician, increased my understanding and empathetic ability with people who are depressed more than probably anything else, any lecture I attended, any other thing. So I recommend that highly.